Hello, we would like to welcome you to our presentation today on the importance of the postpartum home visit. I'd like to give you a little bit of an overview of our presentation today. First, we'll be giving you some background on the postpartum home visit and what's present in the literature today in that regard. We will be talking with two of our home visit nurses from our birthing unit and also our lactation consultant from our unit. Of course, we know that the time of birth is a very exciting time for families. However, it can also be a time of mixed emotions. The baby is long awaited through 9 months of pregnancy, and with the birth of the child becomes the ending of the pregnancy and the transitioning into a new family. There are many role changes that need to take place at this time of transition, and all of a sudden, mother and father become parents. And they are expected to know what to do to take care of this brand new infant. However, unfortunately, as we know, we do not have the same instincts to know exactly what we need to do to take care of a baby who is crying. And most of the role modeling behaviors that we know are that which we have learned through our parents, because there's no real formal training to be a new parent. It's interesting to note that though we do spend a great deal of time educating ourselves in Lamaze and in childbirth preparation, there's no formal training classes that we teach parents how to transition into this new role. Parents also have very high expectations for this time in their life, and we certainly know that this is a time of transition. Talk to me about the difference as a nurse in changing maybe some of your assessment skills and some of the way that you would set up your day in the hospital as compared to the way that you would set up your day to be out in homes.
Yeah. I think primarily, though, the in-hospital nursing skills definitely help with my home visit. Mm-hmm. I mean, there's a lot of training there. There's a lot of good experience there as a newborn nurse that I can take into the home. I mean, for several days in the hospital, hopefully we don't have a baby that's very jaundiced, but we see the initial undertones. When we get into the home, we're still developing that skill with the color changes, and we see a more jaundiced baby, and we're going, this isn't right, and this needs to be taken to the physician. We always have that communication between the doctor and the nurse in hospital as well as out in the home. I think it's a continuation of care.
Mm-hmm, definitely. How have you found the difference as far as being more autonomous and maybe not having other nurses around you to double check or help with that?
Oh, that's a good point. I truthfully like that independence. I like being able to be out there in the home and really develop those skills on my own, and also learn about the community resources that are out there. I think one thing with home visits, though, you have to have some support system there. So you may not have that nurse right next to you, or that you can go out to the nursing station and ask, but you got the phone, and we call in and talk to the coordinator of the program a lot. We have our meetings, so we're able to kind of brainstorm. But also then, too, if there's any concerns, if I feel there's any concerns about the baby or mom, I'm making that direct call to the physician. So I guess I really have developed more of that relationship with the physician.
Could you talk to us a little bit about your point of view as a lactation consultant on our unit, your point of view of the home visit process, and what kinds of things you see as being important?
Mm-hmm. It's very interesting. When I first came to Mercy 6 years ago, there was no other breastfeeding support, so to speak, professionally speaking. Mm-hmm. And we all know that the father's support is the very most important thing, and of course that varies amongst the couples. But it's very important too to have everybody on the same wavelength, so to speak. Mm-hmm. And that's a process, getting everyone up to speed on in the world of lactation. when the home visit program really got up and running, and the nurses who were doing home visits became lactation educators, who were certified as lactation educators, it helped me a lot in that I felt that I wasn't out in the ocean by myself, for one thing, even though the nurses were coming along. But once those nurses went to the formal educational program, it really made a difference. And I guess we were a little bit surprised, thinking that maybe once the home visit program began, that I would actually have less work to do. But again, surprise, it was kind of the opposite. I actually had more phone calls. I had some extra in-house return moms coming for problems. And as you and I talked about, we really think it was because more problems were being identified and helped. Before the home visit program, I personally did not make follow-up phone calls with every breastfeeding mother. I gave them my number. They called me with any problems. And I would say I was averaging maybe between 100 to 150 phone calls a month. And as the program began, and also our market share increased, so we had more births, so that accounts for some of it. But normally now I do around 200 phone calls a month. I think part of it too is when women know that we are a resource for breastfeeding questions, whether it's their home visit nurse or calling me back, they feel less intimidated to call. And so maybe that accounts for some more of the return phone calls and so forth. I also have had more calls from the home visit nurses when they identify a problem and they're not quite sure what to do. They use me as a resource, but then they are the ones that are working directly with the mom usually. Sometimes they'll shift the mom over to me. She'll come in, or I do go to her house sometimes as needed. But so it has made some big changes in kind of a subtle way, really. Not real acute, but noticeable when you stop and think about it.
Yeah, definitely.
Well, I really, really enjoy what I do an awful lot. And I think the reason is when we go into the home, we're so appreciated by the services that we have to offer. And the couples are very receptive to the information that we give to them. And it's just a time to really help the family to make that best start and to feel more confident in their care for their new baby and in their relationships with one another. And it's really nice to be an instrument in helping that all come about.
Yeah, that's very rewarding.
And it's just nice to be appreciated for what you do.
I think that's very true. What we're talking about today is the importance of a postpartum home visit. If you could summarize in one idea or one concept, what do you think the most important thing is about visiting people during this early postpartum time?
The most important, I really can't just think of one, but I think the fact that we go into the home and we assess the well-being of the mother and the baby is very important, in the fact that we can curtail any problem that could become a much larger problem. I also think another most important part is the fact that we can be available for the mother so that when she leaves the hospital, she's not all alone. And we do a very good job in reinforcing that, letting her know that we are there for her, that there's always somebody available at the birthplace in case she has questions. And I think the home visit helps to give another open door, because prior to when we were doing the home visits, we would tell them, here's our phone number, call us at any time. But I think the fact that we come into the home, we develop a rapport with this family, they're more likely to feel comfortable in giving us a call if something does come up.